Now, if you see the scapula bone here, the front side there is another process. There is the front side, there is another process. So this is the different process. That is called coronoid process. I will show you in the image. So two process, one process this and one process this. One is the front, one is the back. So I will show you both. Let's see. So we can see here in this image, we are looking from the back side. So this is the spine of scapula, which I'm talking about. And this is the process which is called acromion process. So this is the spine of the scapula. And the muscle who is here, that is called supraspinatus. And the muscle located here, which is called infraspinatus. So the supraspinatus muscle and the infraspinatus muscle, there are two muscles here, right? Now there is another process in the front side. If you see the front side, there is another process. Sorry, it is called coracoid process. Coracoid. Coracoid process. So in this way, there are two processes, coracoid and acromion process. Let's see in this image. So this is the scapula bone. You are looking from the front side. This is the back part towards me. And this is the front part. This is towards you. ये back part है. So in the front part, we can see this is the coracoid process. On the back side, this is the acromion process. Now, if I turn the scapula to the back, so now we can see this is the spine of scapula and acromion process here. Okay. So this we can see the cavity. ये यहाँ पर एक cavity है. So this is the spine of the scapula and this is the cavity here. So this is called supraspinatus fossa. कि supraspinatus का खड्डा, वो खड्डा जिसमें supraspinatus muscle आएगी. And this is the infraspinatus fossa, right? Here the infraspinatus muscle आएगी. So this is the, ये खड्डा है infraspinatus का. So the supraspinatus fossa and the infraspinatus fossa. So we can see here in this image. So this is the muscle, this is the area which is called supraspinatus fossa. This one. And this one is the infraspinatus fossa. So this is the supraspinatus fossa. And this one will be the spinatus fossa. And here muscle will come below the muscle supraspinatus muscle and the infraspinatus muscle. Now, if we see this is the upper part, so we are telling this the uppermost part is called superior angle, and this is the lower part called inferior angle. ऊपर के भाग को हम सुपीरियर एंगल कहते हैं और नीचे के भाग को हम इंफीरियर एंगल कहते हैं. लेट्स सी इन द अदर इमेज. So if you look at the scapula bone here, so this is called superior angle, and this one is called inferior angle. Right. So coming back here. So now if we see the scapula bone, the inner side is called medial border and the lateral side is called lateral border. So this is called medial border of the scapula, and this is called lateral border of scapula. This is superior angle and this is the inferior angle of scapula. तो ये हमारा मीडियल बॉर्डर, लेटरल बॉर्डर, सुपीरियर एंगल, इंफीरियर एंगल. तो इस तरह से स्कैपुला को डिवाइड किया जाता है. सो लेट्स सी इन दिस इमेज. So this is the medial border, and this lateral side will be the lateral border. The upper part will be the superior angle, and the lower part will be the inferior angle. Clear? So in this way, there are various landmarks. Now, if we see here, the most important part, this is the glenoid cavity. यहीं पर शोल्डर जॉइंट का निर्माण होता है. दिस इज द ग्लीनोइड कैविटी. So we can see here शोल्डर जॉइंट यहां पर अटैच होता है. So this is the glenoid cavity, and this is the neck of scapula. ये scapula की neck है. So now the shoulder joint is formed here. यहाँ पर shoulder joint का निर्माण होता है. So let's see here. So shoulder joint is formed like this. So this is the glenoid cavity, and this is the head, and this is the shoulder joint. So this is the glenoid cavity, and this is the neck of scapula. ये scapula की neck है. Now when we see the shoulder joint is formed, जब shoulder joint बनता है, So the glenoid cavity very small area and the head is very big. So here you can see how the shoulder joint is forming. Only some part of the head is touching the glenoid cavity. Lots of part is free from the glenoid cavity. Glenoid cavity is very small and the head is very big. So let's see here. अगर आप हिप जॉइंट की बात करोगे तो देखिए या अदर जॉइंट की बात करोगे तो पूरा का पूरा बोन ऐसे फिट हो जाता है. द एंटायर बोन गेट फिट. बट हियर this is not fitting fully. It is very small and head is coming like this. See, so there are many other structure like the rotator cuff found here to provide the stability. अकेले इसकी ये क्षमता नहीं है कि ये शोल्डर को स्टेबल कर दे क्योंकि ये बहुत छोटा सा है. जैसे आप है ना एक रस्सी पर चल रहे हो, रस्सी छोटी है, आप बड़े हो, then you need some extra support. You are walking on the rope. In the same way, this is the glenoid cavity. It's a very small area. The head of the humerus is very big area. So there might be displacement. Suppose you are doing movement and there might be displacement. Because it's very small. Like here, if joint is making like this, like we can see the hip joint, there are no chances of the displacement. But here you can see this is a very shallow cavity. Glenoid cavity is very shallow. So there are many muscles around who provide stability. बिना उन मसल के स्टेबिलिटी आना संभव ही नहीं है. Not possible. So we'll discuss what are the muscles who provide stability. हम उनकी बात भी करेंगे कि वो कौन सी मसल है जिनसे स्टेबिलिटी प्रोवाइड की जाती है. राइट. ओके. तो चलिए मैं आपको एक बार क्विकली बता रहा हूं, फिर आपको बिना देखे लिखना है सारे नाम स्कैपुला के. मैं आपको एक बार क्विकली बता रहा हूं, जस्ट within 10 seconds. Then you have to write all the name and put in the chat box or in the group. Okay, let's see here. So this is the scapula bone. This is the spine of scapula. This is the supraspinatus fossa. This is the infraspinatus fossa. This is the superior angle, inferior angle, medial border, lateral border. This is the acromion process, and this is the coracoid process, and this is the glenoid cavity, and this is the neck. इतने स्ट्रक्चर आपको, and this is the acromion process, and this is the acromion angle. चलिए अब आपको मिलता है 1 मिनट, सारे नाम लिखिए चैट बॉक्स में. मेमोरी एक्सरसाइज. So one more thing I would like to tell you here. So we can see the scapula bone here. ये हम पीछे से देख रहे हैं. We are looking the scapula bone from the back side. हम इसे पीछे से देख रहे हैं. If we go to the front side, there is a muscle that is called subscapularis muscle. यहां पर एक मसल अटैच होती है जिसका नाम है subscapularis muscle. So this is called subscapular fossa. Let's see in the other image quickly. So we can see here from the back side. So these are the various muscles. If we remove them, then we are reaching to the scapula bone. Now, if we remove the scapula bone, in the front side, there is a muscle that is subscapularis muscle. ये सबस्कैपुलरिस मसल है. सब मतलब नीचे, स्कैपुला के नीचे. So this is called subscapularis, subscapular fossa. चलिए लिखते जाइए, लिखिए लिखिए. वेरी गुड सरबजीत जी, सोनी जी. स्पेलिंग थोड़ी बहुत गलत होगी, चलेगा, नो प्रॉब्लम. श्वेता जी वेरी गुड. सुप्रास्पाइनेटस, ओके वेरी गुड. स्पेलिंग मिस्टेक इज ओके, नो प्रॉब्लम. ओके. If you are not able to remember, just write the which you remember. जो भी थोड़ा भी याद है वो भी लिखिए. ऐसा जरूरी नहीं कि पूरा ही लिखना है, कुछ तो याद होगा, वही लिखिए. यस प्रीति जी वेरी गुड. राधा मलानी जी, स्पाइन. सुकृति जी, श्वेता जी. ओके डन. एवरीवन रिटर्न. कैन वी प्रोसीड नाउ? कोई बाकी है? सो नाउ वी विल डिस्कसिंग द मसल, द प्रोवाइड स्टेबिलिटी. नहीं तो शोल्डर जॉइंट डिसलोकेट हो जाएगा. सो द मस्कुलर स्टेबिलाईजेशन इज डन बाय टू थिंग्स. दो चीजों के द्वारा मसल्स, हमारे शोल्डर जॉइंट्स का स्टेबिलाईजेशन होता है. द नंबर वन, दैट इज कॉल्ड pectoral girdle. See here, pectoral girdle. The meaning of pectoral girdle is scapula and clavicle. So the two scapula and the two clavicle together are called pectoral girdle. So these are the pectoral girdle. Two scapula and two collarbone. एक आगे से और एक पीछे से, दोनों एक दूसरे को स्टेबिलिटी प्रोवाइड कर रहे हैं. So they are providing stability. Okay. But this alone is not having that much capacity to provide stability. The real stability is coming from muscles and the joint capsule. So first let's talk about the muscle. इतनी सारी मसल हैं जो शोल्डर जॉइंट को स्टेबलाइज करती हैं. Without these all muscles, you can't stabilize your shoulder. You can see the muscle of the chest, the muscle of the back, and the muscle of the shoulder. The first four muscles are rotator cuff. Rotator cuff muscle. They call sits. Supraspinatus, infraspinatus, teres minor and subscapularis. ये पहली चार मसल, ये चार मसल को मिला के कहते हैं रोटेटर कफ मसल. They provide stability. Other than there are more muscles I will discuss now. These four muscles together are called sits. So let's see here. This is the supraspinatus. This is the infraspinatus attached with the scapula. This is the teres minor. And one muscle I will show you shortly. Let's see. I'm showing only the four sits muscle. मैं आपको केवल फोर सिट्स मसल बता. So this is the supraspinatus. This is the infraspinatus. We can see the supraspinatus, how this is coming to stabilize the shoulder here. It is coming from both the process. हमने बात की थी कि दो प्रोसेस होते हैं, पीछे होता है acromion, आगे होता है coronoid. The supraspinatus muscles coming in between to provide the stability. The infraspinatus, we are looking from the back side. Then this is the teres minor. ये teres minor है. And if you see the front side of the scapula, अगर आप scapula के front में चले जाएं, so this is the subscapularis. How the subscapular is also coming to the shoulder joint. So these four muscle providing stability. ये चार मसल शोल्डर को पकड़े हुए, ऐसे ऐसे पकड़े हुए चारों तरफ से. So right on the sits muscle. वो रोटेटर कफ की वो चार कौन सी मसल्स उनके नाम लिखिए. SITS. The four muscles, very important muscles, they provide stability. वो पकड़ के रखती हैं शोल्डर, ताकि शोल्डर डिसलोकेट ना हो जाए. Because we have seen the shoulder joint is not having good stability in the, we are telling it, incongruent. Shoulder joint is incongruent, not having proper stability. Supraspinatus, infraspinatus, teres minor, and subscapularis. Four muscles. Okay, nice. Okay. So again, see the rotator cuff muscle here. So the supraspinatus muscles, infraspinatus muscle, teres minor, and this is the subscapularis muscle. These four muscles providing stability to shoulder joint. ये हमारे shoulder joint को stability provide करती हैं. But other than that, there are many more muscles, and the most important muscles is deltoid. This is the deltoid. ये जो मसल है, ये deltoid muscle है. How it's making the cup, we can see here. Deltoid muscle. We can see the three part of the deltoid. हम deltoid के तीन part देख सकते हैं. One in the middle, one in the back. So deltoid is having three parts. We can see the deltoid is three part: anterior part of the deltoid, middle part of the deltoid, posterior part of the deltoid. You can see the deltoid muscle here. It is providing stability. यहीं पर तो इंजेक्शन लगाते हैं. This one. This is the deltoid muscle. So we can divide in three parts. The anterior part of the deltoid, the middle part of the deltoid, and the posterior part of the deltoid. We can see, if we keep the forefinger, we can see the deltoid muscle is very bigger. It's coming. We can see the belly, how the belly is coming down. So the deltoid muscle is, I think, 4 to 6 finger bigger. It depends person to person. So this is the deltoid. It provides very good stability. It's making the cups. तो देखिए रोटेटर कप इधर से आएंगे ऐसे ऐसे पीछे से और यहां से deltoid. They are making a wonderful. They are providing the wonderful stability. So the deltoid muscle is having 3 fiber. Anterior fiber, middle fiber, and the posterior fiber. So deltoid muscle is having 3 parts. Deltoid muscle is providing stability from the outer side, and the rotator cuff muscle providing stability from here. So let's see in this image. So when the person is having some pain, some problem, we need to find out exactly which muscle is having problem. आखिर किस में problem है? In the front side, we can see there is the chest muscle, pectoralis major. ये हमारी छाती की muscle है. We can see how this muscle is, attached with the humerus bone. हमारी humerus bone से attached खींच के पकड़े हुए से. So this is a chest muscle or the pectoralis major. It is also providing the stability to the shoulder joint. So we can see. So this is the chest muscle or the pectoralis major. It holds the humerus bone like this. So now you can see that's why it's not easy to dislocate. इसलिए शोल्डर का डिसलोकेशन होना कोई इतना आसान नहीं है. इतने सारे स्ट्रक्चर पकड़े हुए हैं. Pectoralis major from here, rotator cuff from here, and here, deltoid from here. So there are too many structures are stabilizing. Now if you see from the back side, अगर हम पीछे से देखें, you can see the bigger muscle that is called latissimus dorsi. ये हमारी ये पीठ की मसल है. कितनी बड़ी मसल है, देखिए कहां तक गई है. ये नीचे कहां तक गई. लेट्स सी हियर. So this is the latissimus dorsi. The latissimus dorsi is the very bigger muscle. You can see till it's attached with the hip bone. We can see it's attached with the iliac bone or the hip bone. It's attached with the sacrum bone. हमारी sacrum bone से भी attached है. So this is the latissimus dorsi attached with the hip bone, attached with the sacrum bone, but here it attached with here also. Let's see. This is the latissimus dorsi. Now see, shoulder is stabilized by hip. Hip भी नीचे खींच के पकड़े हुए shoulder को. देखिए. So hip and sacrum also stabilizing the shoulder with the help of latissimus dorsi. ये देखिए latissimus dorsi यहाँ पर attached है. हु इज स्टेबलाइजिंग? आपका हिप बोन, आपका सैक्रम बोन भी आपके शोल्डर को नीचे की तरफ पकड़े हुए कि कहीं डिस्प्लेस ना हो जाए. So there are very wonderful arrangement. So that's why when the person is having any problem with the hip bone, with the sacrum bone, it will also affect the shoulder. ये हमारे shoulder को भी affect करता है. So in this way, this is the latissimus dorsi. ये हमारी latissimus dorsi है. Yes. This is the deltoid. हमने deltoid की भी बात कर ली. The three part of the deltoid. We have talked about the pectoralis major. हमने pectoralis major की भी बात कर ली. We have talked about the supraspinatus, infraspinatus, teres minor. We have talked about the subscapularis. Two last muscle I will discuss with you here provide stability. So one is the teres major. अब teres major कहाँ होती है? Teres minor, teres major साथ साथ होती हैं. So we can see here, one is the teres minor and one is the teres major. अंदर की minor है, बाहर की major है. यानी दोनों major और minor, both muscles are located here and they provide stability. So let's see here once again. फिर से देखिए. So these two muscles, how these teres major and minor are holding. So look at here, this is the teres major जो अंदर चली गई and this is the teres minor जो ऊपर आ गई. तो कैसे क्रिस क्रॉस होल्ड कर रहे? Teres major and minor. The final and the last muscle, that is let's see here. हमने आपको बताया था कि स्कैपुला का जो आगे का पार्ट है इसे हम कोराकोइड प्रोसेस कहते हैं. दिस इज कॉल्ड कोराकोइड प्रोसेस. The front part of the scapula is called coracoid process. This one. I'm turning and now we are looking from the front side. So this is the coracoid process. And this is the muscle who is coming from the coracoid process called coraco and attaching with the humerus brachialis. Coraco brachialis. Done. Over. इससे ज्यादा मैं आपके माइंड पर स्ट्रेस नहीं दूंगा. It is too much. So just what I want, I will go through with all the names once again. You try to memorize and write down in the chat box. If you don't remember, just write in the group after finishing the class. So I will go through once again with all the names. Just try to memorize and write the name. Then we'll conclude the session for today. But these structures are very important to provide the stability. Any one muscle can create the shoulder pain. इसमें से एक muscle भी problem करेगी, shoulder pain हो सकता है. Okay. So quickly I will go through with all name. Just memorize and write the name. So the number one, we talked about the rotator cuff, supraspinatus, infraspinatus, teres minor and subscapular, which is in the front side. सबसे पहला हमारा था rotator cuff. Yes. Subscapularis was in the front side, which is not visible from here. This is the subscapularis in the front side of the scapula. Then deltoid muscles. So anterior deltoid, the anterior fiber of the deltoid, the middle fiber of the deltoid and the posterior fiber of the deltoid muscle. ये हमारी डेल्टोइड मसल के तीन पार्ट. आप सिर्फ डेल्टोइड भी लिख सकते हैं. ओके. देन फ्रॉम द फ्रंट साइड द चेस्ट मसल और द पेक्टोरलिस मेजर. हमारे आगे ये चेस्ट की मसल है जिसे हम पेक्टोरलिस मेजर कहते हैं. On the back side is the latissimus dorsi, who is providing stability from the level of hip bone and the sacrum bone. तो ये आगे और ये पीछे. Then this is the teres major, and the last muscle is the coming from the coracoid process of the humerus, that is coracobrachialis. Coracobrachialis. Done. तो चलिए अब आपको मिलता है 2 मिनट. जितने नाम याद है चैट बॉक्स में लिखिए, ग्रुप में डालिए. चलिए ग्रुप में डालिए, व्हाट्सएप ग्रुप. अगर आप मोबाइल से क्लास कर रहे हैं तो यहाँ चैट बॉक्स में लिख दीजिए. राइट ऑन. And tomorrow you have to memorize these all names of the muscles providing stability. Very good. रितिका जी, आपने कितना सुंदर डायग्राम बनाया. एक्सीलेंट, बहुत अच्छा. आप तो एकदम क्रिएटिव पर्सन हैं. थोड़ा सा अलग अलग कलर का यूज करके बनाइए तो देखने में और सुंदर सुंदर लगे. अभी नहीं है पेन तो बना दीजिए जैसा भी है. जितने भी बंडल पार्टिसिपेंट हैं उनको ये सारी रिकॉर्डिंग बंडल में ही दिख जाएंगी, और जो अलग से एनरोल पार्टिसिपेंट हैं उनको एक्सेस हमने कल दिलवा दिए. अगर ना मिली हो तो 10 बजे के बाद प्राची जी को कॉल कर लें. लेकिन बंडल वालों को एक्सेस की जरूरत नहीं है, उनको तो एक्सेस उनके बंडल पैकेज में ही दिख जाएगी. वेरी गुड प्रीति जी. सुप्रास्पाइनस फोसा मसल का नाम है. ओके, डन. तो जो लोग बाकी हैं, मैं अभी मीटिंग को क्लोज कर रहा हूं. जो लोग बाकी हैं वो ग्रुप में लिखिए. दे कैन राइट डाउन इन द ग्रुप्स. ओके. सो थैंक यू सो मच एवरीवन. नाउ सी यू टुमारो. अब हम कल मिलेंगे. लेट्स क्लोज द सेशन.